Now I know what's involved in having my veins treated, I really do wish I'd have done it 10 years ago and alleviated all this itchiness, heaviness, and been a bit more confident 10 years earlier. Hi, my name's Gaynor Faye. You probably best know me from Emmerdale and Coronation Street and Fat Friends, and I'm here at Vein Centre. I've just had some varicose vein treatment. I was going to Japan and I knew I was going to be doing a lot of walking, so it was brilliant that I had the treatment beforehand, because I did like 30,000 steps a day and there was lots of stairs up to temples and things. So for the end result, it's worth it. It's not very long and it's definitely worth it. Hi, my name's Gaynor Faye. You probably best know me from Emmerdale and Coronation Street and Fat Friends, and I'm here at Vein Centre. I've just had some varicose vein treatment. So I did ballet as a young girl, and I first kind of started to notice them then, so from being very young. And as I've got older, I had one kind of quite protruding vein, but then on the other side of my leg I started to get really itchy, and a really itchy leg, and I realised that there was some veins kind of starting to protrude out of them. But what was really awful was the heaviness of my legs, the heaviness and the itchiness as I got older, and as I sat down more and more writing, it became more apparent that they were getting worse, not better. I kept getting told to be active, and I am active. I run, so I thought that would help, but it didn't make them go away. So, yeah, the sight of them, but mainly the heaviness and the itchiness, was what I couldn't stand anymore. Obviously, being an actress, for me, it's all very visual. We're out there, we're on the screen, so. Sometimes I would be a bit self-conscious if I had walking away shot and you could see the back of my legs. Not that anyone could ever see, but obviously I knew, so it would make me self-conscious. And as an actress, the last thing you want is to be self-conscious. So that affected me. And then writing, obviously I'm sat down, it's sedentary, you sat down a lot, so I will be up. So I've bought myself a stand-up desk now. And I walk a lot. I try not to sit down too much now. The experience of the treatment was strange. I didn't know what to expect. I knew that it wasn't going to be painful, but there was going to be little bits that weren't, it's a bit like when they take blood and they say this is going to scratch a bit. So there was a couple of scratchy bits, but other than that, it's not painful, it's just strange. It's an odd feeling. And then you get this kind of garlicky taste in your mouth, which is really odd. I was going, what did I have for tea last night? But then that goes really quickly, and Mark offered me a lollipop if the taste didn't go, so that was a win-win. Yeah, I think I just realised that it was going to be pretty straightforward procedure, and he was going to be with me by my side at all the time, and consistent throughout, which was brilliant, so that you didn't have to see another doctor each time. So when I came for the procedure, he put me straight at ease. Everyone did, actually. Everybody here was brilliant. And yeah, I mean, the stockings weren't the best thing. However, you have to do that. That is a means to an end. And they came off on the 7th day. I whipped them off and washed them and put them away. But the whole procedure was great. Yeah, I'd say it was just a little bit strange. There's a little bit of pressure, but it's nothing too painful. And for the end result, it's worth it. It's not very long and it's definitely worth it. It didn't prevent me walking or running. In fact, I went to the gym the week after and just took it easy. So I reckon about 4 weeks later, and my legs were back to normal. And the best thing about it, after 4 weeks, was the fact that I had no aching legs. I just could get I've got a 3-story house, and I could just get up to the top of my bedroom really easily without any achiness, and the itching has gone. Oh, that's so good, because I used to just scratch and scratch and scratch on the night, and that was about 3 weeks. But the fully recovered 4 weeks later with no pains or little aches. So having had my treatment, I wanted to, I was going to Japan, and I knew I was going to be doing a lot of walking. So it was brilliant that I had the treatment beforehand, because I did like 30,000 steps a day and there was lots of stairs up to temples and things. So yeah, I'm sure that it really helped me be able to fit those steps in. I'm definitely more confident now wearing my trousers to my knees, shorts to my knees. I've got to do a bit of work on myself to be more confident to wear shorter shorts at the moment. But yeah, I think definitely now I feel confident that the lower half of my legs, which where the veins were, yeah, I can expose them to the world again. I think the most rewarding part is the fact that from a very early age, I've had this thing about this one vein on the back of my leg from ballet. Well, it probably wasn't the ballet that created it. I don't know. I just recognised it when I was doing ballet. And that was very young. So obviously to have that treated so far down the line has been great. And actually to relieve the itchiness and the aching legs has been the best. It's a wonderful place. It doesn't feel like you're in a, medical environment. It's very homely, very friendly. And Mark certainly told me everything that he was doing and kept me very much, up to date with how things were. And he was there at the end of the phone if I was worried about something. I got to talk to another nurse as well who alleviated any of my worries. And the actual treatment is much less invasive than you think. Well, it probably is invasive, but it doesn't feel it. It feels fine and it's over very quickly. So yeah, for the outcome, I would definitely go through it again. Now I know what's involved in having my veins treated. I really do wish I'd have done it 10 years ago and alleviated all this itchiness, heaviness, and been a bit more confident 10 years earlier.